Commissioner has said, we are here because we are keen also to see how we can further strengthen and deepen the partnership between Kenya and India. A partnership that for many years was a very strong cooperation, and one which we are keen to revive for the mutual benefit of our two peoples. We have had very good discussions, the Prime Minister and those that we have met, and I strongly believe that we have agreed on a number of fronts that I believe will help us as Kenyans achieve our objective, as Ambassador Maora has said, of becoming a middle-income country within the next 10 years maximum. But again, I have made it part of my itinerary when I travel to also meet our diaspora. Because our diaspora, I believe, is a critical part of Kenyan society that has long been ignored, but has the capacity to contribute greatly to Kenya's development. Indeed, as I say often, we have 47 counties in Kenya under the new constitution, but I have chosen to declare a new county which I call the Diaspora County, which is the 48th county, who have special interests and needs that they need a government to cater for. And we've been having regular sessions. We now have a policy. I don't want to go into the details. The PS has told you what we have put together. And as a result of our close collaboration with the diaspora, we have even seen remittances grow to 2015. Kenya receiving from Kenyans abroad over 1.6 billion shillings. Today, the Kenyans abroad are contributing more than even tea and coffee contributes to the Kenyan exchequer. So you see how important it is. And it is our wish to see that we continue to facilitate you, both in your work, in the countries that you live in, and also to make it easier for you to invest and to continue to do business in Kenya, even while you work outside the country. So that I want to assure you is something that we are taking very seriously. Let me also say that the number of Kenyan students also in India has also dropped quite considerably to what it once used to be, possibly as a result of the increase in the number of university spaces now being available, back home. But we are also working to see, as your chairperson just mentioned, to see how we can get an increase in number of slots for those who may wish to study in India for certain specialized courses that may not be necessarily available at home. So as much as there are few of you, one of the take-homes we can say we have obtained is a willingness on the part of the Indian government to increase the number of slots that are available to Kenyans wishing to study in India. Other than that, I would just like to address myself to the issues that were raised, and I go in order with the way that they were raised. And I think the first one was NHIF. First, every Kenyan is eligible to NHIF, and everybody pays the same. So if every Kenyan is eligible and every Kenyan pays, I find it very difficult to appreciate that they are discriminating, because the principle of NHIF is for us to be able to provide health care for every single Kenyan, whether you're a civil servant, whether you're a farmer, whether you're a makanga, a matatu driver, mama mboga on the streets, a kiosk owner, you should be treated the same.
Yes.
So balozi, hiyo na kuhakikishia, I will take up as soon as I get back. If there are benefits that are being given to some Kenyans that are being denied others, I promise you I will take action on that. As I have said that, before I go on to the next one, I also want to encourage Kenyan students also, because I said the diaspora is also the 48th county. Please register as NHIF members. You never know what tomorrow will bring. Register, you are entitled to it. So you should register yourselves, have your NHIF cards. That will also help you as you move on. You are entitled to NHIF and you should register. With regard to doctor training, that again was part of the issues that we were discussing with the Prime Minister today. And again, there has been a willingness to increase the number of slots that are available for specialized training for our doctors, medical attendants, those who will be working on some of the new equipment that we have brought in. So that is part of the proposal that we have put forward, and there is a willingness of them to extend that so that we can increase the number of specialists that we have to be able to serve better those Kenyans at home. We also appreciate that as much as it is, India has really provided us a great service in terms of availing their facilities at relatively low cost in comparison to other parts of the world. It is still expensive for those who travel, and we know because we have seen and participated in many harambes where people are raising money to support patients who have to be taken to India. And so one of the things that my government is keenly working on is to see how we can improve our medical facilities back at home, so that we are able to provide the services that people come and seek here in India back at home. We are working keenly, especially beginning with issues of early detection, and we're trying to see how we can get all this equipment, not just in Nairobi, but also kule mashinani, in every single county. Some of this we're doing in partnership with some companies here in India, with other companies elsewhere. We're also working with the Indian government. They made a donation the other day for a cancer scanning diagnostic machine, which will be installed at Kenyatta National Hospital. We have not stopped there. We have agreed also